I think that he is very, very much at home in the work that he does now. He is the program leader for veterinary medicine. He's with the Texas Agricultural Extension Service, and we're happy to have him with us tonight. His subject is calving problems and solutions. But this time, we'll turn the program over to Dr. Faries.
So Wayne's asked me to demonstrate to you the proper way to assist a cow or heifer that's in trouble, that's having difficult calving time. So this is going to be a demonstration, but before I do the demonstration, I want to show a few slides on the screen, and that will sort of set the scene so that you can see what I'm going to do in the calf delivery. So there's a number of things I'm going to demonstrate with this calf, but before we'll turn the lights down, and I'll begin showing you an overview of calf delivery at a time when a heifer or cow is having trouble, and she's having a difficult time in having her calf. The birthing process is called parturition, and parturition is the term for birthing, and in cattle we just normally call it calving. So we got a cow calving, or we got a heifer calving. She's in a birthing process. She's in parturition. I use this slide to help you see how the calf is positioned inside of the cow. The cow rear end is toward me, to your left, and this calf is in the belly of the cow, and this is the proper position of a calf inside the cow. To illustrate, this calf that's inside the cow is not laying flat. It's not laying horizontal or parallel to the ground. It's dropped off into a hole. So the butt of this calf is dropped off all the way down to the bottom of the belly. However low the bottom of the belly, the abdomen is, that calf is all the way down to the bottom. So the butt and the hind legs, which are folded up under the rear end, they're not extended out behind the calf, they're folded up under the calf, and that rear end, the butt and the hocks, are dropped all the way down to the floor of the belly. And then the front legs and the head and the neck are extended upward to be presented to the outside. So this calf is inside the belly in this position. I use this slide because the table demonstrations don't do that very well to illustrate that drop down. So never picture in your mind as you assist a heifer or assist a cow that you're pulling a calf straight out because it's laying in there flat and you're just going to slide it right on out. If you was able to do that, if the calf was laying flat, well then we could just hook onto the legs of the calf and just start driving off in a truck or driving off in a tractor or stretching out with a calf puller, you know, if we're going to go just straight out. But that's the wrong way to pull a calf, because the calf is not going to be pulled straight out because it's not laying flat. It's dropped off into this hole, which this rear end now is dropped off into the belly. This is another slide to illustrate that same point in which this cow is standing. The rear end is to your left. You see the rear end of that calf is dropped all the way down to the floor of that abdomen. This drawing is showing an outline of the cow. It's also showing the outline of the bones that surround the birth canal. So the birth canal is surrounded by some bones. This is the bone itself, and we're looking right straight into it as a cross section to illustrate that the diameter really is greater obliquely, going diagonally, like from corner to corner, than it is going crossways. And I'll be illustrating that in the demonstration. I'll be talking about three different stages in the birthing process. Those three stages: stage one is the birth canal dilates. The second stage is the expulsion of the fetus, or the fetus is to be delivered. And then third is the expulsion of the membranes, or the afterbirth. Here's a heifer that's in a process of having her calf. It's a little dark slide, but I think you can see the points I want to make. Is that this heifer was trying to have her calf. We brought this calf up into the stall, and she laid down on some clean hay. Now our attempt now is to get this calf delivered, and our first step is to examine the heifer to see for what reason she can't deliver her calf. Well, it's very obvious in this slide, and as we knelt down and looked at the rear end of this heifer, what the problem was is that the external part of her vagina, the lips or the vulva are too small. The opening is too small. The opening is not large enough for both legs and the head and neck to come through. And that's her problem. So we just simply knelt down and stretched that soft tissue. Just stretch that opening. So by placing both hands on both sides of the vulva, the lips of the vagina, and just separated her hands, just stretched that tissue, and then she strained and just popped the calf out. Just fell right into my lap. So that was all we needed to do to assist this heifer. It was not hooking on with a tractor. It wasn't using a calf jack. It wasn't taking 5 men. It was just simply realizing what the problem was, and it would just mean that the external opening was too small. And that's quite often a common problem in heifers because they've never had a calf before. That opening has never been stretched, so quite often first calf heifers that are calving at 20, 24 months of age just have a small opening, and it just needs to be stretched. Occasionally we have to use a knife to cut it. Can't stretch it enough. Just do a episiotomy, just taking a scalpel and making an incision diagonally upward to 2 o'clock or to 10 o'clock and just make a larger opening. But that's all that was needed. This is a dark slide, but we see the feet are white, the lower part of the legs are white, and then the nose is black, and you see a real thin membrane laying off to the right. That's a transparent thin membrane, and I'm going to come back to talk about that membrane. That is not the water bag, but we do see that thin membrane, and we need to identify that thin membrane and know when we do see that's in the presentation. Here's a line drawing of a calf that's being delivered, and to your left, of course, is the rear end of the cow, and the top part is the lower back, which is the backbone, the lower part of the back. And that calf's head is reared up. It's reared up and is rubbing real tight against the lower back, just the sacrum area. So we could attempt to pull this calf by putting some chains or straps on the front legs and start pulling several hundred pounds, and we'll end up pulling those legs off because that calf is not going to come because the head is reared up and is tightly adhering to the lower back. So the attempt on this calf was to examine the heifer and see, well, for what reason she can't have her calf. So by hand examining, by reaching the hand in, realize that the head is just reared up. And it doesn't take any pulling, it's just simply lowering the head. So quite often, when I was in practice over in southeast Texas and East Texas, I could put my hand right up there on top of that head. And as she goes to strain, I just pull down on that head, and then here it would start coming. Well, but in practice, I'd hold it and act like I'm having some trouble because I got to charge $75, so you hold it, act like you're having a little trouble. Otherwise, you just pull down and she strains and then she just spits it into your lap. So in delivery, quite often there's no pulling on the legs. It's maybe stretching the vulva or doing some manipulating, and then she strains and delivers her own calf. And I get away from using the word pulling a calf because I don't like to pull a calf. I'm going to end up walking the calf out. So if there's any type of a pull, that pull is an attempt to walk the calf out. I'll be demonstrating about the proper way to put chains or straps on the lower part of the leg. The upper leg, which is the right front leg, there's a chain that's looped above the ankle. And if that's the only way you put that chain on that leg and you start pulling, you will break that leg or you'll create some injury to the joint. And quite often ones that use that technique end up with a crippled calf because there's too much strain in one area right above the joint. And quite often that leg is severely broken. The left leg, the lower leg, the chain is properly placed. So I'll demonstrate that there is a loop of the chain above the ankle, but then there's a half hitch loop below the ankle, which will distribute the pressure from above the ankle all the way down to the hoof. That will create a distribution of the pressure so it will not injure the leg. Here's a radiograph, or as we call it, an x-ray, as showing that lower leg was broken, and it just caused one loop was put above the ankle, where there was a hay string to a leather strap, to a nylon strap, or to a chain. That quite often breaks that leg. Another line drawn, we have the calf being delivered, and we see it's all bunched up. To your left is the rear end. There's chains placed on both front legs. They're not properly placed yet. There's not a half hitch below the ankle. But stop. Got to figure out, why can't this heifer have her calf? It's all bunched up. There's not enough distance, not enough width for both front legs, which would be both elbows and both shoulders, to get through this birth canal at the same time of the head and neck. So the arrows are pointing to where it's bunched up. The elbows and the shoulders can't come through, because in this birth canal there's two side bones, and those two side bones are so far apart, and there may not be enough width to get the elbows and the shoulders to come in at the same time the lower part of the legs and the head and neck are coming. So there's no way to deliver this calf in pulling both of those legs at the same time. You'll just keep pulling and pulling until you end up pulling a leg off. You have to deliver this calf one leg at a time. And the way to do that, I'll demonstrate. You work it one leg at a time. So at one point, you eventually get maybe one leg completely extended. And this next slide shows where one leg is completely straight. It is completely extended, which is that right front leg, that top leg. The lower leg, the left leg, is still bunched up, but now there's more room for that left leg to be extended, because we've got the bunched up disappeared. That the bunched up elbow and shoulder now is straightened out. Same way occurs when a calf is coming out backwards. This one is true backwards. It's not breeched. The hind legs are extended back, coming to the outside. But quite often, we'll see right in front of those bones that there is not enough width for the two hips to come through. The hips are just simply too wide. So both hips can't come through the same time. So if you grab a hold both of the rear legs and start pulling, you'll just pull the legs off without moving the calf, because the hips can't come on through. So you got to get one hip through at a time, working it back and forth. And in this case, one hip got through, the leg is completely extended, the hock is extended, the stifle is extended, the hip joint's extended, that right rear leg is completely extended. Now we can get the left leg extended. You can't work these at the same time. And I'm going to be repeating that throughout this demonstration. Never pull both legs at the same time. And I'm going to keep repeating that. You don't pull them the same time. And I know there will be veterinarians that will do that, but they've got some experience or technique that they'll maybe tie both legs together, or they'll pull on them at the same time. But that's very difficult to do. You have to have a certain amount of skill to be able to do it. It's much easier to never pull both legs at the same time. You end up pulling one at a time, which will be walking the calf. You'll never see a cow push a calf out or pull her calf out with both legs at the same time. When she's laying down and straining, one leg is out further than the other at all times. She'll strain and one leg will get further out. And then she'll shift and she'll start straining, and then the other leg gets further out. Then she'll shift and strain, and then the other leg gets further out. It takes turns. It alternates, so she's walking it out. As you put your hands on those legs, you're going to have to do the same thing, alternating back and forth, never at the same time. Once the calf is delivered, there's a lot of mucus in the mouth and down the throat. So one of the best techniques is to hang this calf upside down. There's other techniques, swinging them all around in this room, to other techniques that will injure the calves. The best way is just for a few seconds, and I'm talking about 3 or 5 seconds, just hanging this calf up and getting your hand with a rag, whether it's a paper towel or a cloth towel, reaching in that mouth, trying to get some of that mucus to slide on out of the mouth and in the upper part of the throat. But just for a few seconds. Soon lay it on down, start getting some more mucus out, because that's blocking some air passage. This calf has not been breathing inside the cow. It's been living off the blood supply from the mother through the afterbirth. But once the navel cord is broken, which is now broken, the lungs have to start expanding with air. And the best way to do is upside down just for a few seconds, 3 to 5 seconds. Once you feel that you've got the mucus out, let that calf on down flat to the ground. And the best way to stimulate breathing is rubbing. That's the best way to get this calf to breathe. Once you've cleared the throat from a mucus, get him flat on the ground, and with paper towels or cloth towels, do a lot of rubbing, especially on the top of the back and on the sides of the rib cage. A lot of firm rubbing. First thing you know, that calf is a coughing and a snorting and a sneezing, and he's a blowing, and he's taking in some air. Some little cartoon slides to illustrate some things that are wrong in delivering a calf. You see this is wrong. We've got two men that are strong and they know they can pull that calf, and that's what they're trying to do, is pull the calf. They're not trying to walk that calf out. They don't even know what the other one's doing. One's looking one way, one's looking the other way. All they got, let's start pulling, it's coming, let's start pulling. As they pull and something's coming, they probably tearing the legs off. That's what's coming. The calf is not moving. You're stretching and tearing the legs. So this is not walking the calf out. Here's a fellow that doesn't have two people, but he's got a block and tackle. He's got a come along. He's got a fence stretcher. He's pulling both legs at the same time, and he'll break that back to pull those legs off. So that's wrong to do. Calf jacks are used, or calf pullers, and I'll demonstrate one. I hate those things. I seldom use them. I'll deliver more calves barehanded, maybe with some chains, but without any mechanical device, such as a calf puller. They quite often damage the calves. They quite often damage the cow. They quite often damage you by banging around on you. So I seldom get this one out of the truck. But when I do, he's using it in the wrong way. He's got both legs tied to the chain, and they're being pulled at the same time. He's not walking that calf out. He's going to break the legs, tear the legs off, break the back. And you'll notice that he's pulling that calf straight out. And I said right in my opening comments, we never pull a calf straight out. This cow is standing, you never pull it parallel to the ground. That's wrong. And each slide, as I back up to the previous slide, he's pulling it straight out. That is wrong. You pull the previous slide, they're pulling straight out. That's wrong. You'll hurt the cow, hurt the calf, pulling straight out. That's the wrong way to go. That goes against the direction that this calf is trying to come out. And I'll illustrate that with a demonstration on the table. Here's the tractor. Many want to grab the tractor, start pulling out, straight out. There's going to be damage occurring because they're going straight out. You may eventually get this calf out with a tractor, but you're going to break some bones in the cow as well as break some bones in the calf. So we'll have the lights returned back where we can use now the demonstration. And to give you a few opening comments in the demonstration is that I've showed you enough slides that you're starting to get a picture in your mind. What is on the inside of the cow. You need to picture that. Don't just think of legs sticking out or you're reaching in there grabbing hold to feet and say, I'm going to pull. You need to picture what's in there. Well, this calf is inside the belly of the cow, but this calf is surrounded by a membrane. And it's surrounded by that thin, transparent membrane that was on one of the slides that was laid to the side. It's a real thin, transparent membrane. And it's covering the whole calf. It's just a complete circle around the calf. There's a little bit of water on the calf, and then there's that real thin membrane. And then outside that thin membrane would be gallons and gallons of water. Gallons of water on the outside of that thin membrane. And then surrounding all of the gallons of water is a second membrane, which is a real thick membrane. It's like a quilt. It's a real heavy membrane. And you'll see that heavy membrane after birth. After you get the calf out or after she has her calf, you'll see the real heavy, thick membrane later. And that's why it's called afterbirth. It's also called placenta. And that's a complete circle, a complete sac. So the calf is surrounded by two sacs, the real thin membrane and then the real thick membrane with gallons and gallons of water between the two membranes. And then surrounding that real thick membrane, the afterbirth, is the womb, is the uterus of the cow, the womb. So the calf is inside of this sac that belongs to the cow, but it is surrounded by those two membranes. Then outside of the sac, the cow sac, which is the uterus, the womb, would be bone. There's bone surrounding the womb. Okay, and that bone is made up of two sides and a top and a bottom. Now when that womb is stretched off down in the belly, it's just surrounded by all of the internal organs and the muscle and the skin. But once the calf goes to the upper part of the womb, once it gets into what we call the birth canal, then it's getting in the upper part of the womb. It then becomes surrounded by bone, two bones on each side, one on each side, a top and a bottom. And then outside the bone would be muscle and the skin. So a calf is in the womb, and that calf is to be delivered from that womb to the outside. For it to go to the outside, it's got to go through a muscular tube that's called a cervix. and that muscular tube is about the size of my forearm. So that calf is in the belly, in the womb, and it's got to go through a tube the size of my arm. But that tube is a muscular tube, and it's called a cervix. And as she gets close to calving, that cervix will dilate, and it will dilate, and it will dilate, so that the diameter inside this tube gets larger and larger and larger and larger, and it'll dilate the size of a number 3 wash tub. It'll get that big around. If it got that big around, that calf could just fall out, or you could just reach in there and get it. But it can't dilate that. It has the capability of stretching and dilating that large in diameter, but since it's surrounded by bone, 2 sides, a top and a bottom, it dilates the limit of the bones. And if the bones are real small in diameter, then it just dilates to a small. If it's a huge old cow that's got a big pelvic bone, then it'll dilate much larger. So that calf is to go through a dilated cervix, a muscular tube, into the vagina, and then to the outside. So that's what you need to picture. But as you're picturing that, you're picturing a calf that's off down in a hole, down in the bottom of a belly, that's got to come up the hill out of this womb and get up into the cervix, which is up at the top of the hill, which is in the pelvic area. And then it gets at the top of the hill, it wants to start going down. It never goes straight at any time. It's always climbing up the hill. As soon as it gets up to the top of the hill, up to the cervix, in the birth canal area, it wants to start going down. So it's a true arc. A true arc is never a flat area. Okay, so when we have a cow or heifer that's in the process of having her calf, she's going to go through first stage, and that first stage is for her cervix to dilate. And she'll spend several hours for her cervix to dilate. And we don't like them to go any longer than 6 hours. So if you ever see a heifer that's in stage 1, longer than 6 hours, she's going to need some assistance. She's normally in stage 1 just about 30 minutes, 2 hours, 4 hours, and we don't like them to go beyond 6 hours. While she's in stage 1, her cervix, that muscular tube, is dilating and dilating, and the womb is starting to contract and get tighter and tighter around this calf. The cow or the heifer is not straining. She's not trying to have her calf as for trying to push the calf out. It's just that her womb is getting tighter and tighter, and her cervix is dilating and dilating. And that causes pain. She's uncomfortable. And so she wants to go off to herself. She gets off in the back area somewhere. She's restless. She's up and down. She lays down. She gets up. She's probably not grazing. You see her that way. She's walking around, milling around, back and forth, up and down, and she's in stage 1. And once you see her doing that, don't let her go longer than 6 hours. So if you go home this evening, and it's whatever time, and you check the heifer out there, and she's doing that, you can't go to bed. You got to stay up and make sure she has that calf, because she doesn't need to be in that stage longer than 6 hours. And you say, well, I'm checking her at 10 o'clock, so that means at 4 o'clock, if she hasn't went into stage 2 by 4 o'clock in the morning, we're going to have to give her some assistance. But sometime during that 6 hours, she's to go into stage 2. When she goes into stage 2, she will start straining. So once you see her straining, her flanks are pulling up. She's laying down, and boy, she's bowing her back, and she's straining, and she's a-pushing. She's defecating. She's urinating. She's having a struggle. Well, she's now in stage 2 because she's left stage 1 and now is in a straining stage. And in the beginning part, the early part of that stage 2, she will break water. She will break water, and all of the gallons and gallons of water will be passed out on the ground because she went to straining and ruptured the afterbirth, ruptured the placenta. Didn't rupture the little thin membrane, which is surrounding the calf. She ruptured the real heavy, thick membrane, that real heavy placenta. And once a split occurred, which is usually right over the head area, around the feet and the head, once that split occurs, several inches long, gallons will rush out because there's gallons of water between the two membranes. All that rushes out. So once you see that she's wet, her rear end's wet, she's laying down doing it, she gets up, all that water ran up under her, she's in stage 2 because she has broken water. And now she's straining. Now, how long do you need to let her stay in stage 2? Don't ever let a heifer or cow strain longer than 4 hours. So you go home tonight and you see one straining. She's wet on the rear end. She's in stage 2. she'll probably have her calf tonight. I'll check her in the morning. No, she only got 4 hours. So if it's 10 o'clock, she better have that calf by 2 a.m. or there is a problem. Assistance needs to be provided if they don't have the calf within the 4 hours. And there's some exceptions to that, is when you need to intervene within that 4 hours. And I want to step back here to see this rear end and say, well, I'm watching this rear end. And I went home tonight and I'm looking, and she is straining. And you keep watching it. And she is straining. And you keep watching it, and she's straining. And you don't ever see anything, and once 2 hours go by, that's long enough. You say, well, he said 4 hours. But if you keep watching her, and you don't see anything come out, and it's been 2 hours, she's going to need some assistance. You don't give her 4 hours. There's no sign of anything. You just keep seeing her strain and strain. Now, once you start seeing something, and that something can be a bubble, you'll see a real thin membrane, and that thin membrane can bulge out and look like a balloon, like a bubble. And that little bubble may even hang down and have some fluid in it. That is the thin membrane that's surrounding the calf. And never confuse that to the water bag. Don't look at it and say, oh, I see the water bag. She hasn't broke water yet, so she's in stage 1. If you see that thin membrane, she has broken water. The only way to see it is for the placenta to have ruptured, for it to be bulging out. So she's broken water. Ones have told me, so I've seen that bubble, and I'll reach down there and I tear it. And now she's broken water, so she should have her calf. No, you didn't tear it and break her water. She's already broken water. But once you see that bubble, that little thin membrane, and you keep looking at it, don't look at it longer than 2 hours. So once you see a bubble, don't go longer than 2 hours. You keep looking, nothing but a bubble. Maybe it's sucked back in, disappear. Oh, it went somewhere. It's gone. Then you go back and look at it. It's hanging back out. Don't wait longer than the 2 hours. Now, once you see the feet sticking out, or the nose with the feet alone, or feet and nose, and see that sticking out, you need to check her every hour and make sure she's making progress. Don't say, well, I see the feet sticking out. She's got 4 hours. No, she's already used up some of that 4 hours to get the feet out. But she's to deliver this calf if she's making progress. So you see the feet sticking out, and you go back to the house and drink some coffee, wait an hour, and come back out here and look at her. And if you see more of the feet sticking out, she's made progress. And then you go back, drink some more coffee, and come back an hour later, and you see a nose with the feet. Well, she's making progress. And at one of those trips, she'll end up having her calf. But if you ever go back an hour later, and it's exactly like it was when you were out there an hour ago, she's going to need assistance if she doesn't make any progress within that hour. And as you go out and check her, you're not taking the whole family out there. You know, and you're not driving out there in the truck and blowing a horn and having a party or something. You're going to shut her off. You'll shut her off. The hormones that's got her in labor are the same hormone that lets her milk down. And there's no way to milk a cow with a party out there in the stall. You got to be real, real quiet. You got to sneak out there. You got to crawl around. You got to hide behind a tree. You got to be real quiet and see what's going on. And if you see progress, allow progress up to 4 hours. Once 4 hours pass and she hasn't had the calf, even though she made some progress, you're going to have to provide assistance. Now, once you decide that you have to provide assistance, you've got to know this cow. You know, how are you going to get your hands on this? You've been sneaking out there. She may be a cow that you can just jump up and drive back to the barn and put her in the lot. Or she may be a cow that if she ever jumps up, she's gone. And you'll spend the rest of the night looking for her. So if she's that type of cow, you won't have to drive out there and step out of your truck, be putting a rope on her. By the time you hit the ground, wrapping around your truck, she's all over the top of your truck, or you wrapping on a sapling, and you snub her off, and now you got her. She's that type of a cow. You got one chance to get a rope on her. But hopefully she's a type that you can jump up and drive back to the lot. And once you drive her back to the lot, do not put her in the chute, because there's no way to properly deliver a calf in a chute, whether that's a narrow lane chute or a squeeze chute. Never put them in a chute, a lane chute or a squeeze chute, because you have to do some manipulating to the right, to the left, up and down, and you can't do that in a chute. If you get them in there and just start pulling, that's what you're doing. You're pulling the calf. You're not delivering the calf by manipulating and walking. So you put her in the lot, and you put a rope on her, and you snub her off to the fence. And ideal would to snub her off behind a gate if that gate would swing to the inside. So you snub her off, you can put a half hitch on her nose and snub her off low, because she's likely going to lay down. If you tie her off up high and she lays down, she's going to be stretched out. So tie her off low. Ideal is to tie her behind a gate, so swing that gate to the inside and tie the gate to the side fence. Now we got her behind the gate, and once she lays down, we can untie the gate, swing it out of the way. But as long as she'll stand, she'll be tied behind that gate. So you tie her off low and snub her off then behind the gate, swing the gate around and tie it. Now you get back here at this rear end, and you look at this rear end, and you decided that you got to provide assistance for some reason. She was in stage 1 over 6 hours. She's in stage 2. She hasn't made any progress, or you've been watching her and hadn't seen anything for 2 hours. For whatever reason, you're now ready to deliver this calf. As you look at this rear end, you've got to clean it up. You can't jump in here and start doing so. You've got to clean it. And if you don't clean this rear end, you may get a live calf out of here, but that may be the only calf she has, because you're going to contaminate her, give her an infection in her womb, and she won't ever breed back. So we've got to get this live calf out, and we want a calf every year thereafter. So many of you go, well, I got it out, but you know, that old cow is not breeding back anymore. You know, something wrong with it. Well, it was an infection that you created in trying to deliver the calf. So we got to clean this rear end. As we look at this rear end, what is the nastiest thing back here? What's the nastiest thing on this rear end? Feces. Is that nasty? May not be. Hadn't hit the ground yet. What's the nastiest part on this rear end? The tail. That's the nastiest thing. That tail has never been bathed. It's been defecated on. It's been urinated on. It's had mud on it. It's had fly eggs on it. It's had maggots on it. It's had flies crawling on it. It is a nasty thing. You don't want that thing to touch you. Once you get cleaned up and get in there, you better not let that tail touch you. It'll wrap around your neck. It'll slap you in the face. It'll get all over your arms. You got to keep it off of you. So you got to get that nasty thing out of the way. That is a nasty thing. If you could put that tail under a microscope and zoom in on it, it'd be just crawling with bacteria. It is nasty. It's a nasty thing. So we've got to get the tail. So we get the end of that tail with a little, like a little cotton rope, and put a loop above the switch of the tail, maybe a couple of half hitches on the switch, maybe fold it back, and we're going to tie a rope to the end of that tail. Now, what are we going to do with this tail? We're not going to tie it to the fence, because you're going to run around and pull it off. So we can't tie it to the fence. So we got to pull this tail forward. And we're going to pull it as far as we can and as tight as we can get it without pulling it off. Because we're trying to get it off, but we want to pull it completely forward, stretch it out, take this rope, and one way to do is to go over the top of the neck and then under the throat and then tie it to the neck. Or we could go under the armpit right above the elbow and tie it right above the elbow. So tie it to the elbow or tie it to the neck. Get that nasty thing out of the way. Now we've got to clean it up. We're going to have to use some soap and water. Very likely we've got to use a brush and to clean this up, because no telling what's got to be scrubbed off that's dried here. We got to brush it and scrub it. So you got to have a bucket of soap and water, and then you got to have a bucket of a disinfectant to go ahead and use a disinfectant. And so I've got a bucket here with a disinfectant, and there's a number of disinfectants, and you need to purchase and have at hand as you get into this procedure some commercial disinfectants, you know, like Novosan, that's a good one. There's Roccal, R-O-C-C-A-L. Those two can be purchased from your veterinarian. If you get caught without something like that, just plain old Clorox or Purex can work, like a cup to a 2-gallon bucket of water. So I've got some of this Novosan in this bucket. So once I scrub up this rear end with a brush and soap and water, an ideal is to use a soap like Betadine soap or some surgery soap, if not, at least a dishwashing liquid, and then rinse it off with this disinfectant. Now, when I was teaching in our large animal clinic at A&M, I'd have the vet students out, the senior vet students out with me, teaching them how to deliver calf. And they always ask, how clean do you want to get this cow? How clean do you want to get this rear end? And I say, I want to get it clean enough to kiss. That's how clean I want it, clean enough to kiss. So they scrub and scrub it. And they say, well, we're through. And I say, well, kiss it. So they scrub it some more. Hey, they scrub it some more. So it's got to be that clean. We're going to scrub up our hands with that soap and rinse off with this disinfectant and not be touching this cow. And keep our hands from touching this cow. This rear end is going to be scrubbed from side to side, just not the little opening. That's not what we're just cleaning, just the little vagina area. We're cleaning skin and hide over here to the sides, from side to side, and then from the anus all the way down to the udder. So we're covering a lot of area from top to bottom, from side to side. And then keep from trying to get all over this cow and touching it. So we're ready now to start manipulating. It's very likely we may have to use some chains, and I've got 2 lengths of chains. This one is 5 feet long. So I've got 2 chains here. Each one of them are 5 feet, and I like 5 feet chains. You need to order these if you don't have them, or see your veterinarian so that you do have 2 5-foot chains. Quite often I need a little shorter chain, so I keep 1 or 2 little 3-foot chains. But quite often just using these 2 5-foot chains. So they go in the bucket. They're not laying on my shoulder. They're not on the chute. They're not on the fence. They're not on the ground. They're in that bucket. Now, I quite often go to your places, and I see that you have these chains. And I see them hanging on the fence. There's flies lined all up and down them. You know, they're filthy, they're dirty, so I grab them when I need them. No, you need to take these to the house and boil them in a pot of water. And turn after about 20 minutes, and then turn the fire off and let it cool down, and then dump it out onto a towel and put these into a Ziploc bag and keep them in that bag until you need them. So you need those 2 chains kept clean. As you buy those 2 chains, you need to buy 2 handles. They can be used with these 2 chains. So I'll be using these 2 handles. These have been boiled for the 20 minutes. They've been in a bag. Now they're going into my bucket of my disinfectant. You also need a device that's called a head snare. It's just a cable. And quite often this is why maybe you call your veterinarian, because you need something to put on the head and you don't have anything, and she would come with a head snare, and I'll be demonstrating that. This will end up going into the bucket too. And as we use these things, they go back into the bucket. So now we're at the point where we want to examine and find out why this cow or heifer is not getting this calf out. And it may be that this calf is all the way down that far. And this ramp is to illustrate that this calf has got to come up out of the hole. We're not standing out here on this rear end of this cow standing and just pulling right straight out. We're reaching off down in here and trying to get from this out of this hole. Now, most heifers and most cows, we can put our whole arm all the way up to our shoulder inside of this cow and reach down into here. Quite often we can put both arms in here. So we can get a whole arm and maybe 2 arms inside of this cow. Now, to illustrate what we're having to go through, we've got the vagina or the lips of the vagina out here that we're going to put our hands in. And once our hands go into the vagina and we keep going further, then our hand is in the cervix, that muscular tube that's dilated, and then we go through the cervix into the womb. And in this case, this calf is still in the womb, it's still dropped off, it's not up into the cervix area. Now, I brought a pelvic bone to illustrate this. Now, when your county extension agent was at A&M taking anatomy, he had to identify this bone. And he kept looking at it, looking at it, looking at it, and he identified it as a Halloween mask. But it's not a Halloween mask, but it is a pelvic bone. And it's in 2 pieces. This is one piece, and this is another piece. This is the lower back. This is the sacrum in which the head of that calf did rear up and rubbed on this lower back. This little top piece fits into this area. So to your right is the rear end of this cow, to your right. Here's the lower back, and it's fastened to these 2 wings by ligaments. There's ligaments that hold this piece, sacrum, to the wings of the pelvic bone. Real tight ligaments. So as you picture this from where you're sitting, you'll see that there is a top bone, and there's a side bone, and a side bone, and a floor. And that floor is the pubic bone, and it's right on the bottom. As we stand up, our pubic bone is more to the front. But a cow standing on 4 legs, that pubic bone is the floor. So there is a floor to this pelvic canal, birth canal. There's 2 bony sides, and then there's the lower back. This one side wings out and protrudes out under the skin, under the muscle and skin, and you see that bone sticking out. And that is a hook bone that is sticking out to the side. And then over here the same, the right wing. And I'm going to turn this so that you can see, you know, there is a floor. You see that floor? And then there is a, you know, a roof. And then as you see, the left side and then the right side. Now, the calf is down here in the belly, in the womb, and it's got to come up out of that womb and go through the cervix. The cervix comes right through here to the vagina, to the outside. So that cervix that is coming from the uterus is going to dilate then the size of this diameter. However wide it is and however high it is, it will dilate. And you'll see that there is greater distance from corner to corner. So we can have a calf come up out of this belly, and both front feet are to come first, and as it come up, then they'll end up both feet coming into here, but then as the nose follows, the nose may hit this side, this left side, and turn to the left side. Or the nose may hit this right side and turn back to the right shoulder. Or it may hit the floor and go down between the front legs. Or it may rear up and hang right up in here like the slide was showing. Or it may even turn completely over on its back. We do have a problem with as the legs come up. Maybe a leg hit a floor or a side and turn, either one leg or both legs. So there's a problem getting both feet and the nose to come in here about the same time to be presented on through here. Now, say, well, the nose gets through here, the head gets in here, the front legs start, but there's not enough width for both elbows or both shoulders. They'll be hanging up. Or maybe they come through, the calf comes on out, it's hanging to the outside, but there's not enough width for the hips. So picture in your mind, as you assist a heifer or cow, that you're delivering that calf through bone, not through soft tissue that's stretching however big you think it would stretch. You're trying to get it through a bony canal. So as you walk this calf out, you're trying to go through that bony ring, and I'll refer to it as that ring, and there is a greater distance from corner to corner. So as you go to deliver a calf, you got to figure out what's there. So as you go in, you feel the diameter of that bone, see how big that circle is. And then once you reach in here, then you're going to start doing some manipulating. Now I'm going to go ahead and pull this calf on up to illustrate another point in positioning. Quite often you'll find that this calf is up this far. You know, the calf has already got up into the birth canal. And if it's up into the birth canal and something is maybe even extended out, always keep in mind that the feet are extended further than the nose. The nose needs to stay at the ankle. Needs to stay at the ankle. So at any time that you see the nose further than the feet, you have a problem. You know, you don't wait an hour or two, you already got a problem. The nose is sticking out further than the feet. The feet need to always extend further than the nose. The nose will need to stay at the ankle. So at any time you may see that that more feet are coming, more of the leg is coming, but the nose is staying back, then there is a problem. So you never wait that hour to progress once you see that there's more leg extended than with the nose, because the nose in this case is not staying up with the ankles. Okay? So as you look at this and see that this calf is already appearing, feet are sticking out, nose sticking out, and the nose is right at the ankle, but an hour went by and there was no progress. There was no change. As you reach in here, you're going to find that this elbow on this front leg is flexed. It's not extended. It's not straightened out. It's going to always be flexed. It's never going to be straightened out. It's going to be flexed. This shoulder joint is going to be flexed. It won't be extended. So there's two joints that are flexed. They're bent. The same way over here. Both joints are flexed. The elbow joint as well as the shoulder joint. And when both elbows and both shoulders get flexed, bunched, that calf is wider. It's wider. But now once the legs get extended, completely extended, both elbows and both shoulders, then the calf is not as wide, it's more narrow. All right, so as you attempt to do some delivery, and you reach in here, and you're going to end up working with the leg, and he said don't pull on both legs at the same time. You do one at a time, but as you're doing one at a time, what your attempts are is to get both legs completely extended. The calf is not going to move. So as you start pulling, what you're doing, pull just a half inch or an inch, and that's about all you can pull. Then you walk over here and pull a little bit more, back over a little bit more. The calf is not moving, is it? But the legs are coming, but the calf is not moving. And the reason it's not moving is that we don't have the legs extended. So you back and forth, back and forth. Now once you get the legs extended, then you keep working back and forth, and then the calf will start coming. The whole calf will come. But quite often we'll find that one will attempt to deliver a calf, and they spend time working the legs. See, again, repeat, they're bunched up, the shoulder is bunched, is flexed, the elbow's flexed, and you start working. So, man, I got quite a bit of the leg out. I got a lot of the calf out, but you hadn't even moved the calf. You just straightened it out. But you have accomplished the point in getting the leg straightened out. So as you work this calf, it's to walk the calf until you get both legs completely extended. Quite often one will get completely extended, then you work and get the other one extended. So in this case, we're getting both legs extended, the nose is still staying up with the ankle, and then now the calf is to start being delivered. And as you deliver, it's going to be one side to the other. And the amount of pull to put on a leg is no more than 200 pounds. Now I can pull 200 pounds with my right hand, and I can pull 200 pounds with my left hand. After a while, I can pull 100, then after a while 50, and after a while I can't even hold my arms up. They get so weak. But right now, I'm fresh and I can pull a total of 400 pounds, and I'll claim that that should be the maximum amount of pull. If this cow is now down on the ground and we're pulling on this calf and we're dragging this cow around, we're doing more than 400 pounds. She's a 1,000-pound cow plus the friction. You don't ever move the cow. Only 400 pounds, 200 per leg. Really prefer about 100 pounds per leg. And if you do them one at a time, pull a little bit, little bit, little bit, and then this one over here got completely straight, a little bit, just maybe 50 pounds, 100 pounds. And we got both of them completely extended. Now we can start moving the calf. And when you move the calf, you're still going to go side to side, side to side. Now the hind legs that are up under will flip, and when they flip, the hips will come on into that birth canal, and we'll have to go through that bony ring. And say, the hips are too wide now. The hips are hanging up, one on each side, and that happens quite often. And to get through that, you have to rotate this calf so that one hip is up in one corner and one in the other corner, diagonal, and there's a greater distance, so it pops on through. Now I'm going to back off, and I'm going to show you direction of the pull, because I wasn't trying to show that as I was talking about walking. But this cow is standing, and this bony birth canal that we're trying to deliver it through can be real tight and have a problem, but we expect the roof, that sacrum, that lower back, to get higher and higher. And I'll need to go back to this bony pelvic bone and to illustrate that this lower back, this sacrum, is attached with the ligaments, and it's attached real tight. The tail head is missing and the tail's missing, so it's gone. But when this heifer goes to have her calf, the ligaments that attach this lower back will relax, so this bone gets loose. It gets loose. And 1 to 2 days before she has her calf, this bone is to get real loose, and it's to start rising and rising and rising, and her tail head gets higher and higher. And the reason for that is to get more distance. And if you see a heifer that's trying to have her calf, and that tail head's pulled down, and this didn't rise, you got a problem. She's probably a candidate for a cesarean section. So our attempt is not to deliver a calf by walking it out. We're to have a veterinarian do a cesarean section because it did not come up. You can test that. Just press on that. And if it's just as hard as a rock, that did not relax. When a heifer does right, this will rise, and you can push on it, go down, it'll come back up. It'll be a springboard. And that's why we call it a springing heifer. So we have a heifer that's a springing heifer when that lower back is a springboard. Now, if we press on this heifer and she's trying to have her calf, and we press on it and there's no spring, she's not a springing heifer. She's just a heifer trying to have a calf, and we got a problem. A true springing heifer would be a springboard. Well, to help get that lower back to rise up, as we're coming out, our direction of our pull has got to go up. So as you see this calf coming up out of this hole, the direction is, upward, is upward. So I'm going to work this calf, and I'm going to work this calf, and I'm not down here low pulling, I'm actually up. So if she's standing, I've got to come right on up, and I'm coming up this direction. And it may likely she's going to lay down, that will help me, but I may have to get something to stand on. She may be a pretty tall cow. I'm never down here pulling. It's always going up, trying to get that tail head to rise up. And I may even have to get up with it this way. It's got to go upward and upward. Once you clear the shoulders, once the shoulders pop out, now that's the peak. It's got to start going downward and never level. Never take a pull level. Once it pops through, you got to immediately start going down with it from the shoulders on, and it just rolls the hips on out. But if you ever pull this calf straight out, the hips will hang up, the shoulders will hang up. We'll have to go upward and then downward. So never do a pull that is straight out. Now, a calf quite often is going to be slippery, and you lose a lot of grip, and you can lose a lot of strength, and you do have to put something to grip. And these chains that I've spoken of, you can take one of these. There's a ring on one end. You double that chain back through that ring and put it on your hand, and sticking out to the outside, it's real easy to put it on. It's just sticking out. But then this may be inside, and you'll have to go in and get the chain off of your hand. But as one's sticking out, you just grab that foot and get that chain off your hand and put it then above the ankle and let it be on the back side. Never have it on the side, never have it on the top. It needs to be on the back side. That's one loop above the ankle. Make a half hitch by folding it over on itself and then put it below the ankle and tighten it. Again, keeping it all on the back side, that there's nothing on the side or on the top. That will distribute that pull. I take the other end of this 5-foot chain and keeping it clean off the ground, make my loop, pick up that foot, get it above the ankle, a half hitch, then below the ankle. And now I have a chain on both feet. Then I have the two handles that I've kept in the bucket of disinfectant, and I can hook those on. Now I've got a better grip. And now I can pull back here, and I'm going to work again one leg at a time, one at a time, until I get both legs extended. Once I get both legs extended, now the calf can come. But I pull one side, and as this cow is positioned, however high I may have to go up, I may have to do that. If she lays down, I can go down there with her. But I always keep that upward pull until I get the shoulders cleared, and then immediately I got to start going down with it. And quite often they'll just fall out. Now, you can lose a little strength with that. If you do, you can have someone help you with that second handle, so that you'll have two of you working it. But if two of you work it, one will pull and then the other pull. You will take turns. You won't both pull at the same time. I'm going to take a 5-foot chain, the second 5-foot chain, and hook it to the first 5-foot chain and make me a 10-foot chain. And that's why I like two 5-foot chains, because quite often I need 10 feet. And I'll just hook the rings together by running them through, double back. Now I've got a 10-foot chain. All right, and I'm going to take this 10-foot chain and wrap it around my back. All right, and I'm going to take this end of the 10-foot chain, make me a loop, and I'm going to pick up that foot again, and I'm going to pull it down, make me a half hitch below the ankle. Now, I can use my whole body. My arms have gotten weak. I don't have enough strength. I've gotten pretty weak, but I can sit back here and use my body. Now, I want to make sure she's tied off. I don't want her running off with me, because you run off, you'll go wherever she goes. So she needs to be tied off. But we're going to sit back, and I can use my body again to shift back and forth. I can even sit down on the ground and put one foot up on one hip and one foot up on the other hip and push with my legs one at a time. Now I'm using my back and my legs and then working this calf out. As she lays down, I keep position, making sure it's going upward, and then once I clear the shoulders, it's got to come down toward her hocks, whether she's standing or she's laying. Now I'm going to put this calf back in and show when the legs are way back in there and you're trying to put these chains on. You've got to realize that the calf is off down in the hole, the butt is down in the bottom, and you're reaching down in there trying to find a foot. And as you're trying to find a foot, there's 4 feet here. 2 of them are front feet, 2 of them are back feet, and you want to make sure you get a front foot. So when you're going all, quite often you'll pass up a front foot and you'll end up grabbing a foot. And you're off down in there, you'll grab a foot and you'll get that foot pulled up and you'll think it is a front foot, but it won't be a front foot. Quite often the front legs are turned back, and when they are turned back, there's a lot of confusion then, And you say, well, man, there's so much confusion, I don't know what I have. So this is where you got to stop and get a veterinarian. So at some point, you may decide that something's wrong here. It's just not a simple delivery. Because you're reaching there trying to find a front foot, and they're all bunched up, like you'll find a foot, and then that will be a rear foot. As you compare a front foot to a rear foot, this is a front leg. There's a foot, there's an ankle, and there's a knee, and there's an elbow. When you're reaching in there, as you feel that elbow, it can feel like a hock. And say, that must be a hind leg, so I'll let it go. And so I'm going to reach along here and say, I feel it, there's the elbow, so I got me an elbow. So that's a front leg. But as you compare the legs, there's an ankle joint, a knee joint, and whatever might feel as a elbow or a hock. There is a joint between this elbow and the ankle. But on a hind leg, there's no joint between the ankle and the hock. So as you work along here, so this is not an elbow because there's no joint. So this is a hind leg. You have to distinguish that. Now when a calf is being delivered, we can think that it could be delivered, head first, like I've been working with this calf as being head first. This calf could be coming out backwards or it could be coming out sideways. That's the three ways it can be presented. Frontwards, backwards, as some say, backwards, or sideways. Those are the three ways. Then it could be upright, like this, upright in this position, or it could be upside down. Quite often they are upside down. They're completely upside down. So they're either going to be upright or upside down. And then as you work with the calf, the different postures of the legs and the head and neck either be like turned back as I'd illustrated, or the head and neck is turned back. So as any attempt, we want to see, is it coming head first, or is it coming backwards, or the legs extended, or the head and neck extended, before you start doing any type of pulling. Make that type of an examination. Now when a calf is coming out backwards, and say, well, I know it's coming out backwards because the feet are upside down. And I always hear that when a calf feet are upside down, it's coming out backwards. That's wrong. You can't do that, because this calf could be coming out frontwards, and he's upside down. A lot of time a calf's coming out upside down. These are not hind feet. This calf's coming out frontwards, and he is upside down. But when a calf is coming out backwards, he's either going to coming out with both hind legs extended, or they're both up underneath him. Either way. So let's look at that. We got a calf that's coming out backwards, and it's been coming and 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 coming, and he's coming on up here. I said, I know this calf's coming out backwards, but I see his tail. He's coming out backwards. So he is coming out backwards. The only way to get these legs extended out to the outside is to push this calf back in. So when she's not straining, you got to push this calf, and you go to push and she strains. You go to push, she strains. Well, you got to stop. You'll need to have the veterinarian come or carry this heifer in to get an epidural nerve block, a saddle block, to deaden this rear end so she'll quit straining. So now she's not straining, and you push this calf all the way back in, go back in, then the hind legs will be extended as you reach in and find a foot, grab a foot, and then flip it. But you can't do that in a birth canal. It'll have to be off down into the belly. All right, now once the legs are extended, and you got both the hocks extended and both stifles and hips extended, then the calf can be delivered, but again, one side at a time, working back and forth, back and forth, back and forth. And again, that upward direction until you get the hips cleared. Now you're at the rib cage, you immediately then start going down. Okay? Now when a calf is coming out frontwards, and you find that it's coming out frontwards, and you get the nose out, but the legs are folded underneath, you know you got a problem. Those legs have got to be extended. There's no way to get the legs extended with this calf here. You'll have to then, without the heifer straining, either by letting her relax or use an epidural nerve block, this has got to be pushed in, all the way back in, and then get these legs then extended inside the belly. Each one extended. So all of the manipulation has to be in the belly. You're shoulder deep doing that. And doing that, you may have lost so much strength, you may not tell what you have, so that would be a reason then to call the veterinarian. So at some point, once you realize this is a difficult delivery, more than you can determine, do stop and call your veterinarian. I would say if you attempted at least 30 minutes and have made no progress, you need to end up calling then your veterinarian. Now there's a time where you've lost so much strength, or you don't have the strength that you need, and you can't do it barehanded. You can't do it barehanded. You then say, well, I will use a calf jack, a calf puller. And there's different kinds of calf jacks, and you need to get the lightest weight one. You only need about 400 pounds maximum, so don't buy these heavy-duty type calf jacks. So I'm going to put chains on and illustrate a calf jack. So I'll put the chains on above the ankle, below the ankle, and I'm going to use a calf jack and show you how to use a calf jack to use no more than the 400 pounds. Using this 5-foot chains to show you that these can be used. You can always, make a loop to even make it shorter. So I'll make a loop there. Now we're going to take a calf jack, and as a calf jack there's different styles. This one's got a straight butt plate, and this straight butt plate is preferred by many instead of the U-shape. So there's not necessary to be a U-shaped butt plate. And then you'll see that there is a jack handle here that you can hook the chains, and there's 2 hooks. So each hook will be used for each chain. And as I move this handle, then the hooks work independently. So as I ratchet this, only one hook moves. And then I ratchet the other one, the other one moves. So it will alternate and walk this calf out. If you have a calf jack that both hooks are fastened together and both hooks move at the same time, that's wrong. Very difficult to deliver. Or you may even have one that's got one hook that you put both chains on. So it should be where you have 2 hooks that are alternating with this mechanism. So I'll get you to hold this rear end of the calf jack, and then let me lay this under here. And let me swap sides here. All right. So I'm going to put one chain on one hook and one chain on the other. Now what direction do we need this bar, this handle? Where do we need it? Do we need to be level to the ground? Got to have it up. Got to be going upward with this at all times. All right, so it's going upward. And if she lays down, you got to make sure it's coming then upward. So now I start ratcheting this, and I walked up to many that's been delivering a calf, and they've got it so tight, and it may not be chains, it may be cables, and I hear a humming sound. And if you hear a humming sound, that's pretty tight, isn't it, if it's humming? So you don't get it that tight, where it's humming. And I see that these handles are bent. They're curved. They even see cheater bars put on these things, where you can get that 1,000, 2,000. This shouldn't be bent. It should be a little short handle. Never make it longer, and just use maybe just one hand. And if you do use 2, it's only up to that 200 pounds on this one leg, 200 pounds. And then once it gets pretty tight, and we look and say, well, it's tight, well, maybe just a little manipulation. It may be that this calf is dry and would need to have some lubricating fluid. And she may have been having this calf for several hours and she's gotten dry. So we'll stop and use some lubricating fluid. May even pump a tube in here and pump in a lubricating fluid. If you're caught by yourself and don't have a lubricating fluid, at least open up a can of Crisco with some shortening and scoop some of that up and go in and let it melt out of your hand. Get it slippery. Make sure it's lubricated and it's pretty tight. And then a little manipulation by just maybe pushing down on this chain. That one leg, see, it just came. And now I got to tighten this one. And then I may just push on that one. So I can just push on it. I can get down. If I lose my strength, I don't have much strength to push down, I can climb up on this. I can climb by the fence, I can climb up on it and stand on it. 165 pounds. Or so. And that's kind of add. I needed a couple of 100 pounds, so I'd stand on that to get a couple 100 pounds full. Now I keep working. And up to that point, the calf had never moved. All that work and the calf hadn't moved. I finally got the legs extended, both elbows and both shoulders. Now the calf is coming. And it's alternating, just like I was doing it by hand. As soon as I see the shoulders cleared, what I got to do? I got to go down. So we'll go down. All right, we'll go down, and we keep ratcheting, and it just slides on out, Now I may have to rotate the calf if the hips hang up, so we're just going to let her just come right on out. So once I get it right on out, I'm going to quickly then take the chains off, and I'm going to get this calf upside down, and get it upside down to get the mucus to drain. Okay, and get the mucus to drain. So I'm just going to hold it just for, a few seconds, just a few seconds to get it. A little bit of drainage. Now I'm going to get this calf laying back down, and I'm going to end up with a paper towel or cloth towel, and I'm going to keep getting this mucus out. I may just reach my hand in and get some mucus and sling it. But I get that mucus out. You can then keep digging around in there, and quite often you'd have a straw. It's good to have a straw. I got a pin here. You can put a straw in here and let it tickle and hold it. Just make sure you use the right end. But tickle on the nose, it'll sneeze and snort. A little bit more mucus in there, get it out. And then after you get the mucus out, which is just a matter of a few seconds, with a cloth towel or a paper towel, a lot of rubbing on the rib cage. A lot of rubbing, long down the back, real firm rubbing. Then you can roll him over and do the other side. Do a little roughness to him. And I think he's coming around with a little bit of breathing. So with a little bit of breathing, we'll end up getting him to come. Maybe check his mucus again, more rubbing. They say, well, this calf, he's just not coming. There's just no breathing there. So kind of a last resort, you've done that, what I just described, getting the mucus out with a lot of firm rubbing with a towel. And so you haven't got the calf to breathe. You can hold this calf in this position, both hind legs, and you can swing it. Swing, swing, swing. And one of these swings, you stop, like that. And he grunts. I think I heard him. Didn't you, Wayne? Yeah. He's coming, I think. And then a little swing, like that, see? And then a little grunt like that. I think we got him. Say, well, no, didn't hear it. They say, well, we got maybe a dead calf. We hadn't got any breathing yet. If you don't have a veterinarian with you to give oxygen or respiratory stimulant, about the last resort to do, before you decide he's a dead calf, is a swinging and swinging, swinging and swinging, and then let him go, like that. I heard him then, so he grunted, didn't he? He grunted. So we let him go. We treat him a little rough now, and we got him. So you got him now. He's starting to breathe, and we're going to set him up cow fashion style, legs folded up, and then we got him. See, he's going to go ahead and start breathing. So that's what it took. That little drop out there in that grassy pasture, a little bit of a grunt. Now, when you go to drive off, if you're out there in that pasture, don't forget where he's at. Don't back over him. That'll happen one time, but don't back over him. Now, this calf has got to get up and nurse within 6 hours. He can't go to bed yet. It's 2 in the morning. He's got to get up and nurse in 6 hours. For his stomach to absorb the immunity that's in that first milk, he needs to nurse that milk within 6 hours. And the amount of that first milk will be 5% of his body weight. So if a calf is 80 pounds, and 5% of 80 pounds would be 4 pounds. And 4 pounds is a half a gallon. And that's 2 quarts. He needs half of that the first 6 hours, and half of it during the next 18 hours. So he ends up nursing 2 quarts in that first 24 hours. So we've got to get a quart of colostrum in this calf. So he needs to get up within 6 hours. So we give him a while. He may jump up in 15 minutes, or it may take 2 or 3 hours. But once he gets up, he needs to run up under there and start sucking that cow. And that cow should let him nurse and give him that milk. Now, if we find that he can't get up there, and we're going to help him. So we got the headlight shining, we got the flashlight shining, we got it shining all over the tits, and we got that calf up there and say, calf, we got lights on it, can't you see it? Can't you see that tit? Suck it. Well, that calf's never seen one before, so he doesn't know what one looks like. And he doesn't need a light on it because he doesn't know what one looks like. His instinct is to go to the dark, so that's why he's up under the throat sucking around, or up under the armpit, because he's going to the dark, or he's back over here in the corner somewhere, because you got lights on him. Get the lights off of him and let him get up under there and help him suck that. Now then, after that, this afterbirth is starting to peel out and come. And it'll start hanging out, and that's stage 3. And it should be passed within 8 hours. So we'll wait on it tomorrow and see if it's passed. And if it's not passed, if it's hanging out, and you give it a day, you give it 2 days, you give it 3 days, how long do you give it before you say, let's go in there and pull it out? Research is showing over and over is not to go in there and pull it out. You're going to cause more damage than just leaving it alone. Okay, so if you're out there say, well, I'm not going to go in there. There's no way to go in there and break it loose completely. So whatever you do break a loose, you're just going to break out pieces and leave some behind. You're going to risk the chance of contamination plus tissue damage. So do not pull the placenta, the afterbirth. A veterinarian can prescribe to you 1 or 2 drugs that you could use to help contract that down. So if you want to try that, that may be adequate for you. One drug is used the first day and the other drug's used like on a second and third day. So that's approach. But the approach can be not to go in and pull that afterbirth, is to leave it alone and let it rot. Let it rot out and let it stink. It's going to get nasty. You can smell her wherever she's at. You can find her. She'll smell. That afterbirth's hanging out and it's rotting. And that's just meat that doesn't belong to her. It's afterbirth that needs to come out. And it'll rot and rot and rot, get bad smelling. It'll finally turn her loose and slide all out, just get slimy and deteriorate. And with her doing that just once a year, or maybe just once in her lifetime, that's not going to hurt her. It's the same as if you took a chunk of meat, and I'm talking about a pretty good sized chunk, and put it in your mouth and just held it for days. Don't chew it up, don't swallow it, just hold it. Just hold it in your mouth. And it'll get nasty. It'll start smelling. It'll get slimy. It'll start draining out. And in a number of days, it'll just slide out. And it won't hurt you. It won't give you gum disease. It won't give you cavities if you do it just once a year. Now, if you do it every day, it would, but just once a year. Now, some of you are getting gum disease and cavities because you eat meat. We ate meat tonight. And if you don't brush your teeth and floss, you're going to smell like that cow. And that's why some of you smell that way, because you never floss. You always got meat in there. You got to get it out of between your teeth. And that's why you smell like that old cow that didn't clean out, because you don't floss. So we just let it deteriorate and it eventually slide on out. And that can be even days later. And as long as she's up nursing this calf, and that calf's falling around, and the cow's out grazing, there's not a problem. But if there's any sign of a problem, like she's not grazing, she's standing around, laying around, then we may have to give her some attention. So my presentation and a demonstration method is show you a number of things. One is to picture what's going on in there, to know what you're manipulating, and that you're never pulling both legs at the same time. You're always walking, and you're going in an upward direction to a point. Then you start going downward in a downward position to go ahead and clear the hips. So it's walking the calf and never pulling the calf. Don't go any longer than 30 minutes. Once you realize you got a problem, go ahead and contact your veterinarian for that assistance. And expect the veterinarian may even have to do a cesarean section. If the calf is dead, he may have to take the calf out piece by piece and do an embryotomy. There is a time when that calf gets into this birth canal and stays for hours and hours, like you may have one out there right now, and you don't go check on her. You don't check on her till 10 in the morning, and it's been laying in this birth canal all evening, all night, till morning time, and that cow now can't get up. And the reason why, the both hind legs are paralyzed. The floor of this birth canal has 2 holes in it, and that's where 2 nerves go. So the lower back has the spinal cord running through it, and 2 large nerves come off. One goes through this hole, and one goes through this hole, each to the right hind leg and the left hind leg. So there's 2 nerves laying in this birth canal. So once this calf comes up out of that hole and gets into this birth canal and lays, and maybe the feet sticking out or the nose sticking out, and just lays there, it's pressing on those 2 nerves. And those 2 nerves will swell and collect fluid and swell. Then that will make a numbness to the hind legs. Now she can't get up because those 2 nerves are swollen. So once they get the calf out, she can't get up, and she won't get up until the swelling disappears from those 2 nerves. And it may take 1 or 2 weeks for that to occur, even with drugs like diuretics and cortisone, to get the swelling out of those 2 nerves. And while we're waiting for the swelling to disappear from those 2 nerves, she's laying around for a week or 2, and other nerves are swelling because her weight's laying on her front legs and other parts of her rear legs, so they're getting numb. So while we're waiting for the swelling to go down on those 2 nerves, we've got to use physical therapy on this cow to make sure the other nerves don't get swollen, as well as to help the swelling on those 2. And the physical therapy on a cow is to push her flat on her side and get all 4 legs extended out and exercise those 4 legs. And one may use a hot shot, just a little bit of a bump, just to make her jerk her leg. Hot shot the other one, a little bit of jerk. and exercise those legs for about 5 to 10 minutes. And then sit her back up, and sit her back up opposite from the way she was. If she had her left side more under, we'll push her so her right side's under. And then 3 times a day you go out there and push her flat on her side and hot shot those legs to exercise them. Don't be lifting them up with hoist and letting them hang. That's wrong. That hurts them. If you do lift them up just for a few minutes, just exercise their legs and lowering them down. Some will even dig post toes, 4 post toes, and lift the cow up and lower her down with all 4 legs in those 4 post toes, and they barely touch the ground, and they hot shot them 3 times a day, and they kick around in those holes. And that may be a good way, is get the weight off of those legs, but never hang them or suspended with the hoist, because that is a problem with other parts of the anatomy of a cow. Now the question always is, once you deliver this calf, what else are we to do? Well, we wait for the afterbirth, and it may just come and say, well, do we put any medication in there? There's no need to put any medication in there as long as you were clean, as I described. There's no need to put pills in here. A lot of those drugs will irritate, so I prefer not to put any medication in this cow. Don't even give her any kind of shots, because it's likely we may want to sell her, and to sell her we'll have to wait for a withdrawal time. I always like to go back in and check for a twin. Quite often this is a problem. That's why we're having trouble, is there's a twin. So we better go check for a twin. If we find a twin, we get it delivered. Once we get the twin delivered, we better go in and check for triplets. So you go in and check for triplets. You may go in there 5 times. So check for the others that may be in there. If you get the second one out, a twin out, and that twin is upside down, it's likely a third one. Quite often when the second one is upside down, there is a third one. But once you decided that you're through, jump her on up and get her on out so she can exercise and start passing that fluid and contracting that wound down. Questions on that? I've kind of rattled on here. Questions that come to your mind, or maybe a comment that you wanted to add to this. Wayne, what do we need to add? Anything you'd like to add to our demonstration before we close?
Well, since there are no more questions, I guess that's all for our meeting tonight. So glad y'all could make it, and we'll see you next month.